the frailty of human life, that it can be taken away by infections and other environmental things at any time, but then maybe we'll walk more softly on the surface of our planet, and that will be a good thing.
From the UK, we've been speaking with Dr. John Campbell, the man who has trained nurses in many countries and specialized in online teaching as well. He's doing it now via YouTube. I check it out every day. His site is campbellteaching.co.uk, campbellteaching.co.uk. You can order his 2 books there. Thank you, John, for generously stepping up to help us in this hour of need and speaking with us on Radio EcoShock.
It's been a pleasure, Alex. Thank you for having me on the show.
I'm Alex Smith reporting.
KCHW 102.7. It's KCHW Chewelah 801. You've got Scott and via distant location, Mr. Brandon Hansen. Actually, I think, Brandon, you are broadcasting from your living room this morning, correct?
Yes, this is the Independent Satellite Studios here at the Butcher Block.
I like it. All right, now, Brandon, we'll just explain to people. Usually we're together on Fridays in the studio. You've been out on the coast a whole bunch lately for the past couple weeks, covering ball games and the such, right? And you were a little scared to come into the studio?
Well, I was just saying, I know you, Scott, have been concerned about, catching things and stuff, and I was just saying, well, I'd probably be the worst person to come into the studio, but not to alarm any people. I don't have any symptoms or anything, but I do have to consider I've been to state tournaments with people from all over the state. So,
and there is a couple week incubation period on the coronavirus. So definitely possible. And we're seeing numbers in Washington skyrocket. I've heard, there's a lot of scary stuff out there online, but projections, if based on what we've seen happen in China are to happen in the U.S., it doesn't look very good, does it?
It's just, this is what a pandemic is, where the numbers kind of spread, and they spread quickly. The issue that health officials are dealing with is just that quick jump. I mean, if you look at Italy, at one point there was something like 100 cases. And then the next couple of days, it was up to 1,000, and now they're up to 15,000. So this is kind of one of those deals where this is just the start of it kind of deal.
Well, and one of the things I read, they said that they actually called Washington State America's Wuhan, and that they were expecting the same kind of explosion here. I know just pretty much over the past day, it's jumped from 169 to the last I saw yesterday was over 453. It's probably way bigger than that today once they release those numbers.
Yeah, once they release those numbers, it has to do with testing too, and they haven't done a huge number of testing. A lot of the tests have been carried out by University of Washington, kind of their medical branch or whatever it has tests, so they're carrying them out there. But yeah, like you said, about over 400 cases, and the thing is, every few days that number grows kind of deal. Again, not trying to alert people, because the majority of cases are mild, you may not even notice. It's just the people with compromised, immune systems that we have to be respectful of, and understand that they are the ones kind of at risk there.
Well, it is definitely spreading across the state. I'm looking at the Washington State Department of Health, and this is, of course, is from yesterday. They haven't updated anything today, but we've got several counties that just have like one case, like Grant County, Clark County, Grays Harbor. Island County's got 3. Jefferson County, King County, 270. Kitsap with 2, Kittitas with 3, Pierce County with 17, Skagit with 2, Snohomish with 108, Thurston with 1, Whatcom with 1, and then they have 46 cases to unassigned counties, I guess. Total yesterday at the end of the day, 457 was the number.
Right, and the governor announcing yesterday that he is shutting down schools in King, Snohomish, and Pierce County for a month.
Wow.
Now, I really want to ask, does anybody, remember a time where, that number of schools were shut down for a month?
No. Most people will not.
Yeah.
I'll rebroadcast
And,
it when we're done today, but I have, it was very interesting. It aired earlier this morning. And it is a recording of a lady from 2008 who was the last survivor from the flu in 1918. And she's got some very interesting stories. It's kind of a stark thing to listen to from so long ago, and people scared about the same things and what happened then. So we'll take a listen to that before the end of this morning. Some other things that were on there. North Idaho College has canceled several events for this week. Moses Lake School District canceled all indoor activities through mid-April. Clarkston School District limiting unnecessary gatherings. All K-12 schools, and as you said, King, Pierce, and Snohomish closed March 17th through April 24th. North Shore School District closed for 2 weeks. Spokane St. Patrick's Day Parade canceled. Washington State University's Murrow Symposium is canceled. South by Southwest. Ferris High School is canceled. Ham on Regal. LA and Boston marathons have been canceled. Cher has canceled her concert at the Spokane Arena.
Not Cher, no.
Yes. Knitting Factory just announced canceling concerts, Whitney Morgan, and all Pacific Northwest shows. So that would include, I know a lot of people are looking forward to Alan Stone.
Right.
So it looks like
even locally, we've had cancel, people cancel a lot of youth wrestling tournaments. Chewelah Mat Class tournament March 21st has been canceled. Kettle Falls canceled their little guy wrestling, and so did Springdale. Northport and then Kettle Falls are planning to go to a robotics trip to Yakima. That's been canceled there. St. Joseph's Hospital has modified their visitation policy, so only immediate family, 2 visitors at a time, and no children under the age of 18. Stevens County Fire District 1 has a social media safety class, or 2 rather, that were canceled. There's a few baseball games that got canceled, but that's more because of weather where they were playing. I believe, except for Northwest Christian, has stated they're not going to allow fans at their spring sports games if those can get carried out there. Let's see here. Coffee and Conversation this morning by the Chewelah School District was canceled, not because, they're worried about, the virus spreading, because usually that's a small group of people getting together, but our admin staff is working on this issue right now, so they're going to be very busy for the next few days. Washington WIAA, that's the organization that does all our high school sports like postseason. They postponed the State Drama Festival and the State Dance and Drill Championships. And all of it. If you look at the sports cancelizations, it's across the board. It's crazy. Pac-12 tournament, Big Sky basketball tournament, Major League Soccer, Major League Baseball, Indoor Football League, the NWAC basketball tournament, NHL, NBA, NCAA tournament, which is a huge one. I can't believe they canceled that, but it's gone.
Even
and the XFL have all suspended and kind of canceled their activities.
I was going to say, even the XFL is canceled, yeah.
Right. And today, this morning, it was announced that the Masters has been postponed. And this is kind of a big deal, because the Masters is a long ways out, actually. So they're just not even going to do it, even because I think a few people believe that, this is going to be a weekend or a few weeks or something. But this is going to be an extended period of no real big gatherings of people.
We've got to make sure it runs its course and it's gone before we all start hanging out together again, right?
Yeah, and that's just the hard part to explain to people is this isn't like a blizzard. This is more like kind of maybe a month and a half, maybe 2 months, and maybe I'm being optimistic. So.
And one of the, I think it was the president of Italy, he likened it to war, and that's what their country was going to go through, and that it was going to get, it was bad already and plan on it getting worse. So one thing else locally I noticed there too that we didn't get in that list was all Spokane Symphony concerts have been canceled through mid-April as well. So if you're holding tickets to any of those shows, they have been canceled. One thing I noticed even on your website and the event calendar, we always talk about how crazy Chewelah is and one event after another. And really after, I think there was a list for the bingo tonight, and we have the play up in Kettle Falls. at the Woodlands Theater, but there isn't even anything else, which is kind of weird for Chewelah because there's all much stuff going on. Everybody's put a hold on stuff. I had a couple shows, show and a play in the works, and we've got that on hold. And it looks like we do our annual event. So we usually do an open house for our birthday this month. We've put all that stuff on hold ourselves. So.
Yeah, and I kind of called the people organizing the Pikakucha and asking them, and they're gonna call the Tri-County Health District and just see what the best kind of course of action there is, kind of deal. So they'll make that decision on Monday. I believe the event's on Wednesday, kind of deal. Mary Poppins, that's going on right now. I called them. They're taking precautions up at the theater. A lot of cleaning stations and things like that. So, but it's very interesting with the event calendar, just trying to figure out if they're actually going to hold events planned or not. That's kind of complicated. So putting it together, I'm calling people and like, are you still going to have it? Or, just let us know.
Wow. So there's a website out there I have visited a couple times called World Meters, and they have like tons of stats. They're scary. But what they're doing is watching the coronavirus across all countries across the planet, and trying to put stats together and share them for people. I know they talk about the comorbidity or the death rates of this disease, and one of the interesting I thought for people that have outstanding conditions, it's kind of scary when you throw out the numbers, but they talk about death rate versus confirmed cases versus what they believe are all cases. And it's cardiovascular disease at the top of the list, which is obvious, with the breathing problems and the respiratory, at 13.2% of people that having that disease that pass away. Diabetes at 9.2%, chronic respiratory disease at 8%. Hypertension at 8 before, and having current cancer puts you at like a 7.6% risk. And then no pre-existing conditions takes you down under all cases to 0.9%. So I know those are
right. And kind of the issue about this, and I want to get across to people, is don't panic and don't freak out. Again, the majority of cases are very, very mild of this coronavirus. The issue is that small percentage of people that have a weak immune system or existing respiratory issues, and what this kind of virus does is attack your respiratory system, and it can cause some serious damage. The issue is we don't have enough ventilators. If this virus spreads to big numbers, not enough hospital beds, and people are wondering, well, we have the flu and things like that, but it's there's no herd immunity to this virus or anything like that. This is kind of a new deal. So what we're trying to do is make sure that this isn't a big outbreak, or this doesn't send a bunch of people to the hospital, because God bless our medical staff. They could very easily get overwhelmed with this, and it doesn't take much. That's what I mean. With the number of hospital beds, just, in the inland Northwest or things like that, those, if you have, I believe the hospitalization rate for the coronavirus is about 10% of cases. So that doesn't take much, that does not
tax our
a
system.
big number of people catching it for those hospital beds to get filled up there.
Well, and I liked the show we aired, EcoShock, before this program. I really like that they delved into the coronavirus and what their scientists had to say about, people saying, oh, you don't need to stop shaking hands yet. And he's saying, no, you do. You do.
Yeah,
you do need to be precautious, because, and I had a friend, and not to pick on her if she's listening, but she said, if it gets this way, I'm going to go get it just to get it over with. And I said, that's the wrong kind of attitude, because as they were talking about the sources of transmission, it is so easy to transmit this. And we touch our face and our eyes and our ears so easily. So you can get it on your hands, very, very easily. And then you don't know where you're going to drop this off. on what counter,
Right.
on what surface, and then somebody else comes by, or the big fear, okay, it isn't affecting children, but if it gets into our school systems and grandma lives with you and you take it home and give it to grandma and she's got a respiratory problem, grandma could end up dying from that. So people don't realize the secondary effect. And I was thinking about this, our country's money happy and sue happy. Are we going to end up in things after this is all over with, like, hey, you were the source of transmission into our family and you killed our grandma and we're suing you?
Well, I mean, you're seeing a lot of sporting events, getting canceled. They're leaving a lot of money on the table, like a lot of money on the table by suspending their seasons and canceling events. These are precautions, and I think a lot of people, heading these organizations don't want to be seen as a source of, spreading the disease and things like that. So I think you're already seeing many steps being taken. To me, it's very encouraging, and I think everybody's, taking the right steps. So I think we're headed in the right direction. I really hope that, things are overblown and, this kind of blows over and we can kind of look back and go, hey, boy, we sure freaked out about that.
Yeah.
But if there's one thing to get kind of worked up over, this would be it here.
If there's one thing to pay attention to, this might be it. All right. Here's a couple more lists. I don't know if you got this in there that just popped up. Spokane Public Libraries have canceled all events. I don't know if Stevens County has canceled all their events for the libraries yet or not. That might be something for us to check on today. Also, Coeur d'Alene libraries have canceled all extra curricular programs. Meals on Wheels in Spokane, where they had meal sites for people to congregate. They called them silver cafes. All of those have been shut down. And I say the one about Coeur d'Alene because we actually broadcast in really well to Coeur d'Alene and Post Falls. Hello, folks.
Right,
So,
right. And you're going to see a lot of that where these public gatherings are just postponed or canceled for a while.
All right. Do you have anything else there you wanted to share? I know you had a press release. Was it the Tri-County Health District for our area?
Yes, the Tri-County press release released this yesterday. They talked about how the governor had said he was prohibiting 250 people gathering in King, Snohomish, and Pierce counties. They are asking people in Ferry, Pend Oreille, and Stevens County to follow this proclamation as well. Now, this isn't like you have to do this or something like that. This isn't a law. They're just asking people, hey, could you please do this? So they're asking people in our area to reduce large gatherings. And it applies to 250, but even other gatherings, it's just a gathering of people. It doesn't have to be a specific size. What they're asking is any gathering where, indoor social distancing is not possible. So if you're all packed in rooms, regional events where, people are traveling from multiple locations from outside the area. So if they come here or you're going somewhere, and we're vulnerable populations. So, older people or people that have weakened immune systems and respiratory issues. If your event kind of meets any of that criteria, they're really asking you to hold off on this because what they're trying to do is minimize exposure to this virus for our residents in the area, which means it would lessen the impact on our communities here in Northeast Washington, which if you look at it, we do have a older population. So if there is one area that really should take this seriously, it's probably us.
Definitely.
Just considering, even the age of people in Chewelah and things like that, there are people with weakened immune systems around here.
Well, and you can say it's only got a 1% to 3% mortality rate, but how do you pick those 3 people out of every 100?
Right,
who's that going to be?
Exactly.
Do you want to pick that? Nobody wants to pick that.
And that, even the president's kind of head scientist on this whole deal said it's 10 times deadlier than the flu. So if you're thinking we're overblowing it,
think again.
Even our government, even our president, who has been kind of combative to the media, he's taken the precaution. He's made several statements about it. He's taken it seriously.
He's canceled he canceled all of his, he was supposed to be somewhere today and he canceled it as well. And he canceled some stuff yesterday that he's even being careful. So that's a good example when the president is doing it. I don't know if you were listening to the program before we started. If you were hearing it through your headphones, Prime Minister of Canada has went into containing himself. His wife tested positive for it.
Right. So I'd just say if you're thinking this is just a little media, fire blitz and we're really pumping things up and whatnot, everybody in every branch of the government is taking this seriously. It just needs to be taken seriously. There's no need to fear. I would just stock up on a lot of Netflix shows you want to watch and
start putting them in your queue right now.
Yeah, exactly. One thing too to kind of calm people a little bit. I know with these tournaments shutting down and stuff, there's been some people kind of out of work kind of deal. But even in Italy, where there was the biggest kind of quarantine kind of deal, they still kind of allowed people to go to work. I don't really feel we're going to get to that point because we have really employed some pretty crazy measures here and cancel a lot of big gatherings. But even over there in Italy where it got bad, they still allowed people to go to work. So, I don't think you're not going to wake up one day and just be like, well, we're not going to allow people to go to work. I think they're going to allow employment because they understand people still need to make money and survive there.
Well, I noticed they're making a lot of moves to try and release funds, and who gets those funds? If it's all the corporates or that's hard to say. But it sounds like they're trying to do things that will mitigate the financial impact to people. But it is something to think about if it prolongs, because even here, like yesterday, we had a board meeting for the radio station, and we pretty much operate month to month, and we were talking about, let's say this continues for 45 days and a particular programming sponsor says, hey, our business is really dried up. We need to hold all advertising for a month or two till this goes back together. We're on such a tight budget. Something like that could make the difference in us being able to pay the power bill on the tower, which is very expensive. So we were discussing if a situation like that would happen, it would be very important for us to keep broadcasting countywide. What would we do to try to keep paying our power bill or that kind of stuff if our income was to slow down, because that could cause some problems. Now maybe we could go to the county and request something from the commissioners to help us out and keep the power on at the tower open. Maybe we could even go to Avista and say, hey, give us some slack. We need to keep broadcasting and stuff. But we were discussing like that and writing down the options that popped in our head in case it continued longer than anyone would want, and we had problems ourselves. So, because would be our biggest thing is to be able to keep broadcasting countywide.
Yeah, and you're right, and I think that's if you're seeing people kind of worried or really looking into this, I think that is the biggest sticker to most people is this isn't going to be the Corona weekend or, the Corona week. We're talking the Masters just got postponed, and that is a long ways out from now. So I think what people are most worried about is just a change in our lifestyle for, again, a month, 2 months, Yeah. So how do you really quantify that, and how do you adjust to that? And we're going to have to make some adjustments for a while.
Well, and just like, Trump's finally getting on board and talking about, doing things and making decisions on this where they kind of drug their feet at first. But he freaked out the Japanese Olympic minister by saying that Japan should postpone the Olympics for a year because they're coming up too fast with this one. And they actually just freaked out all over Trump. But we could very well see that happen and something they have to deal with. But you can understand when a whole city has geared up for this massive of event that's going to bring in, millions of people. And that's got to be, how do you undo that once you've started that machine?
Right.
So that's a scary one too.
Exactly right. So those are the shifts and changes we're seeing, and I think it's more, it's funny, it's just more our own reactions to this that are going to be to affect your daily life more than probably the actual virus or anything like that.
Well, the big shock of Tom Hanks and his wife getting it, and that he has diabetes, and he's in the at-risk category, freaked people out online yesterday. Like, oh my gosh, Tom Hanks has it, So, and what was it this morning on the news? Charles Barkley. Awaiting awaiting test results locally here in Chewelah. Last night at Safeway, I had to call you, didn't I?
Yeah, you did. You had to tell me Safeway is out of toilet paper.
I couldn't. That's not the way I worded it, but But yeah, it was weird, because you'd seen the pictures on the news of Seattle and stuff, but to actually walk in and see our own one grocery store with the shelves bare in the toilet paper aisle. And I keep telling people, and we'll say it here on the radio again, it only shows up, there's the same number of cans of peas missing. It only shows up because of the large amount of shelf space that toilet paper takes up. They can only put so much on the shelf because it takes up more than most all other, I'm not going to say food, but products. So just realize that it is not all gloom and doom, but yeah, we did panic and buy all the toilet paper in Chewelah.
Yeah, that is true. That is a good point. It takes up a lot of space, so not a lot of people have to buy it before it's gone.
Yes, that's true. And I'm sure they'll probably have more on the shelves today, but it was weird to look down the aisle. I'm glad I didn't need anybody because I'd have been disappointed if I did, There were a few boxes of napkins left, or a Kleenex and that kind of stuff, but and I didn't go check the hand sanitizer, but I imagine if the toilet paper was low, the hand sanitizer was too. So even people locally being aware and preparing, it's not a bad thing.
Right. Acres United Drugs said they were out of kind of rubbing alcohol and aloe vera. Because people are kind of homemaking it. So they're basically out of those. And they're also out of masks. And they're about a month out on getting restocked on those.
Yeah, if any business or agency that's going to be looking for that stuff is going to have a problem right now. And then somebody pointed out to me yesterday, they said, that stuff's probably all made in China.
Yep.
That doesn't necessarily make it bad. There's some debate. The interview we're gonna play from the elderly lady who passed away, that was witness to the flu in 1918. She refers to that as the Asian flu, but in the media they refer to that. They keep referring to it as the Spanish flu. Do you know anything about that?
Right.
Okay. Do you know what that is? And then I heard a comment last night when we were talking from Dr. Jazz. He said, no, that there was another Asian flu, but that was later on. So.
Right. You had a time period where basically it was World War I and a lot of people traveled. So you had a lot of different things kind of going on there. One would even say, the flu really started in United States military barracks. That's kind of where at least our government saw it firsthand, and with a lot of our troops getting sick. And really, it kind of started a little bit there, and then we kind of shipped our troops around the country and then overseas. So, you could almost, kind of look at that as well. But I think the biggest thing back then was just the mass transportation of people because of World War I, in boats, in enclosed spaces for long periods of time, which is not a good, not a good thing if you're trying to avoid viruses spreading.
Yeah, we've seen what happens on boats, right?
Yeah, exactly.
All right. Let's see here. I don't think I have anything else since we don't get to share the same computer now. I don't think I have anything else this morning that I wanted to toss out there. Did you have anything we didn't cover?
No, that is essentially kind of what we have going on right now. I'm going to continue to update kind of our canceled events list just so people can check and see. I'm not putting something on there until I get kind of official confirmation from a trusted source. And also if you're canceling an event, please let me know. I'll be posting at least once a day and then updating constantly, just so people know if that event's going to take place or not.
And the radio station, rather than duplicating services and stuff, and since we're all volunteers here and the newspaper so graciously offers it, we get all of our information about events and what's going on in Chewelah from the Chewelah Independent website. So as Brandon just said, a great place to cancel your event, and when things get back to normal, to post your event, and it always ends up on the radio too, because they share that with us. So thanks for the work you do there, Brandon. All right.
Yeah.
All right, so that's we did kind of a different show this morning. We thought it was important to get that out. I really wanted to rebroadcast the EcoShock program from this week, where they're usually dealing with global warming. I just thought the scientist on there was very well spoken, very commonsensical. And I hope people appreciated some of his advice on how to deal with it. And like Brandon saying, stay calm, stay smart, and be safe. And do that foot bump, or what we discussed yesterday on the radio. Somebody has started is they live long and prosper, Mr. Spock Vulcan sign.
Oh, I'm going to do that one.
Yeah, that's an awesome one. Yeah. And when we can touch again, you flip it sideways. It's nanu nanu.
Yeah, exactly. Perfect.
All right.
Perfect.
Well, I appreciate you not wanting to possibly infect me. That's scary for you. I mean, you're a young, healthy guy, but just to have been over on the coast and in situations where there are tons of people, and that you don't know what's really going on for a couple weeks, and then people are surprised, and we could see a big explosion here in Washington State. In fact, if Washington State follows what's happened on the rest of the planet so far, it's not going to be very good for us. So be prepared, right?
Yeah, I think all these measures will help out. And I think once all is said and done, we'll be like, phew, we really dodged a bullet there, because, thankfully a lot of people are not just boastfully continuing to hold their event. They're canceling it. And I think everybody kind of seems to see the benefit in that, and how we can, you've heard the term, kind of soften that bell curve kind of deal to a point where it's just kind of a slight bump. So if we can do that, I think, it will be in good shape there.
All right. As of yesterday, just kind of throw these out so people realize, what's starting here and what has happened other places. China, as of yesterday, over 80,000 cases. Italy, you had already said this, 15,000, and that was a huge jump in one day. Iran, 11,000. South Korea, 7,000. Spain, 4,000. Germany, 3,000. France, almost 3,000. And the USA, as of yesterday, almost 2,000. Now, here's something kind of interesting in the new case development. Iran yesterday had 1,289 new cases. South Korea, 110. Spain, a huge jump of 1,000. Germany, a jump of 372. The USA, a jump of 135. But get this, in China, they only had 22 new cases yesterday.
They're on lockdown is the thing. I think that needs to be recorded.
And that could be it could be a very good sign that what they're doing is working. I mean, it's when it's dropped to 22. I mean, that's a crazy jump. And one thing, we bag on the Chinese and the products and how they like to hide stuff and not tell the truth. But I really liked in the show earlier this morning, they were talking about the methodology that the Chinese are using to determine whether somebody is over the flu, and it's incredibly stringent. They've got to have 2 negative tests and a whole list of other things, have not had a fever in 48 hours. I mean, it's very stringent to say they're over this. So them with the harder containment and having a total of 80, they've got more cases by far, 10 times the cases of any other country. And yesterday they had the lowest new cases, which should show that and the lowest amount of deaths. So it looks like their containment issues are helping, which is a good sign.
Correct. And I think, you kind of need to look at that if you're wondering, well, why are we canceling? Isn't that kind of overreaction? And it's like, no, look at how fast it spread in China before they, instituted kind of quarantine and, didn't have these gatherings. And now look, it seems to be working. So, hey, let's take these precautions, because we don't need that strain on our medical system.
That's right. All right, no big events this weekend in the city of Chewelah, and some very cold temperatures. So find your cuddle buddy and get ready. Snow is supposed to start this afternoon. 40% chance of precipitation. It's going to be weird today. As the day goes on, it is going to get colder and colder and colder. It might even start out in places like, in the lower places in Spokane and here in the Chewelah Valley as rain. but it is going to turn to snow because during this whole storm as it moves in, like I said, it's just going to continue to get colder till it drops all the way down to 21 tonight while it's snowing. That snow is going to continue all night long through tomorrow morning. We've got a 70% chance of precip, a high of 27 tomorrow, an overnight low again of 15, really cold. Then things are going to start swinging back to normal. Sunday, a mostly sunny day. It's going to be really wet and mushy if we get a ton of snow. 43 and 21. Then really back to normal for Monday and Tuesday. Monday, 49 and 25. Tuesday, 55 and 29. So a huge difference there. We are under a winter storm warning. If you do have to travel, be careful and don't forget to take your hand sanitizer.
Yes, correct.
All right, Brandon, anything else to add?
No, I think that's all I got.
All right. And reporting from his living room, from the Chewelah Independent, Mr. Brandon Hansen. Thank you very much this morning, Brandon.
Yeah, thank you there.
All right. Kind of odd to do it outside the building, but you did great. So thank you. Round of applause. All right.
Hey, can we do this again? I don't have to leave my living room. This is fantastic.
All right. Yeah, we could work on it. But you are a little beer canny, but it didn't sound too bad at all. So appreciate your time this morning and being with me, Brandon. All right. Yeah. It is KCHW Chewelah. You be safe out there and have a great weekend. Anything big pops up, we will be on the air with an update for you, either I or Brandon. Thank you very much. It is KCHW Chewelah, and we're going to leave you with that interview. This is an elderly lady. She passed away in 2008. She was 100 years old, and she was the last survivor from the Spanish flu of 1918. And she talks about what it was like to be a family that wasn't infected when everybody else was sick. It's very interesting. It's Alex Smith and EcoShock coming up next here on KCHW Chewelah.
There is all kinds of coronavirus news breaking all the time, but we need to hear this witness from 100 years ago. 1918 influenza pandemic survivor, Mrs. Edna Register Boone, was interviewed in 2008 in Mobile by the Alabama Department of Archives and History. It was recorded in 2008 when Edna was 100 years old. She tells us about surviving the last great pandemic to sweep humanity, words for the future as well as the past.
My name is Edna Register Boone. I was born in 1907 in rural Houston County, Alabama. We moved away from the farm when I was 3 years old and moved into the little town of Madrid, still Houston County. Times were troubled, a war going on, the flu epidemic that followed, the boll weevil, 3 catastrophes right there. A new disease, just like another epidemic would be, perhaps, maybe not the flu, but something else. And it would be a new disease. We would have to learn to deal with it. I was 10 years old, and my family was the only family in the little town that did not contact the flu. Therefore, my parents became automatic nurses. They nursed every family in town, and one family in particular was outside of town limits. My father and Uncle Eli, whom we called his manservant, dug a common grave and buried 3 people in it, mother, father, and a young daughter. Unfortunately, we had no sanitary conditions in the area at that time. So the people were buried in the clothes they died in and wrapped in the sheets because there was no way to no one to wash the bed linens for them. So they were buried in a common grave. I do not remember a single church burial caused by the Asian flu. It was prevalent. The greatest problem, of course, was getting medication. Only had one doctor, Dr. Andres, a wonderful man. He did the best he could. We had no penicillin, no sulfur, nothing to treat that dreadful disease. Of course, there was wagon loads of sick people lined up at his front door all the time. If you loaded a sick person whom you could no longer help and put them in a wagon, which is what most transportation was, put them in that vehicle and take them to Dothan, to a hospital, that chances are that patient would be dead when they got there. Okay, if it wasn't, there would be no room. The rooms would be filled. The doctors would be worked to capacity. That's why most families just buried their own dead. The flu itself, the so-called, I think they called it the Asian flu, affected the throat and the windpipe and chest, and lack of medication. We had a little drugstore, and he had a pharmacist, a hired pharmacist, but he could only supply Paragard or maybe mentholatum or what kind of ointments they put on their chests. But that's about all there was. And my mother's would take a half a teaspoonful of soda and put it in a glass of water for each of us, my twin brothers, and for me, and we would drink that before breakfast. I've often thought that that's what saved us. She said that soda would neutralize the system, and we would be less subject to pick up the germ. It must have worked, because we were the only family, entire family, that escaped having that dreadful flu. It was my job as a 10-year-old to take food to people, to families that were all of them stricken. Mama would put a gauze bandage around my face, and she kept sterilized fruit jars on the stove at all times, and she would fill those jars with soup or whatever there was, and I would take those jars to the home of an afflicted family, knock on the door, and leave the food at the door for someone to come pick it up. It was not a pretty picture. One thing I remember that my father did, there was an open space on one side of our house, I would say the west side of Papa plowed up totally. I don't know what the measurement was, but I'd say 1/4 of an acre, and planted sweet potatoes. And I would say that half of the community lived off that potato patch, because no one was able to go shopping. No one was able to cook. They could bake a few potatoes, even if it was in the fireplace. I knew I had to participate. I knew that my family was being protected. I was raised in a Christian family. I knew I had to do my part. I came home one day, I don't know where I had been, but I came home and Mama was stretched out on a pallet in front of the fireplace. Oh, I panicked. Mama, Mama, are you sick? She said, no, child, I'm just so tired. I wanted to get as close to the fire as I could. She said, I knew if I got into that bed that I might not ever get up. We were like a great big family, you might say. I doubt if we had 200 residents. It brought families closer together, and it brought our little town closer together because we all suffered losses suddenly, say, within 3 or 4 days, or some sort of epidemic sweep through. I think the only thing I could suggest about that is to be aware that it could happen again. Children need to learn about what could happen. Of course, I'm sure hospitals are aware. But the shock wave that sets in when something like this happens kind of stuns people, you know. They go beyond thinking correctly. And lots of times I would come in and I would cry because of all the sickness that was around me. And I knew that sickness was deadly. It was depressing to me. Be aware. Be aware.
That was Mrs. Edna Register Boone from Mobile, Alabama, on her experiences as a 10-year-old in the 1918 Spanish influenza, which they called the Asian flu. Find links to pretty well everything in this show at my website, published Wednesdays at ecoshock.org. I'm Alex Smith. Be well, and please join us again next week for more Radio EcoShock.
Well, Victoria, I can tell you that I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And
how can they say a thing like that in times like this?
It's a free country.
And a free press, I may add.
KCHW 102.7, today's COVID-19 reporting featuring Brandon Hansen of the Chewelah Independent is available as a rebroadcast on our YouTube channel. Visit YouTube and type into the search box KCHW Tube, and it'll take us right to our page. Thank you for listening. This is KCHW 102.7 FM.
Hi, I'm Micah Hanks, host of the Micah Hanks program, where every week we go in search of the most unusual things that our world has to offer, from unexplained aerial phenomena and ancient mysteries to the latest in science and technology. On every episode, we take you down the rabbit hole with expert interviews from scientists and authors to those who have firsthand experience with the uncanny.